I'm going to be discussing on role of minimal residual disease measurement in myeloma. And MRD is an important area of our research at every stage in clinical setting. What we do using that is that when we diagnose a patient, there are a certain number of myeloma cells, usually 10 to the power 12. Currently, when patients go into complete remission, that goes down from 10 to the power 12 to 10 to the power 9 or thereabouts. There are still a billion cells present in body when we call a CR. And we know that most of the CR patients relapse. So obviously, when we say myeloma is gone by current method, it's not gone, it's there. So now with better technology, we are able to measure presence of one myeloma cell in a million. When we call CR, it's one myeloma cell in 100. So we are doing almost 3 to 4 log more depth of response. These are technologies either by sequencing, which is slightly more sensitive, or by flow-driven method, which also can be done in real time. So either of the method, when we detect absence or presence of one myeloma cell in a million, we are looking at much greater depth of response. And number of studies have shown that when you have patients achieving MRD negativity, they do much better. They have a longer progression-free survival, and they have a longer overall survival. And within that setting, now the effort is how can we get patients into MRD negativity? That's becoming focus. So now having confirmed MRD as an important endpoint, that is being incorporated in all our studies. So all newer studies have it. The most recent Pollux and Kester study, data on MRD was presented by Professor Loiseau. Very exciting results. He also presented later on the IFM DFCI study, which clearly showed that if you get MRD negativity, patients do better. Doesn't matter how you get there, whether transplant or no transplant. And that information means that if we use certain treatment and get patient into MRD negativity, we may or may not need transplant. We may or may not need a maintenance. We may or may not need consolidation. And this is very important for future, that we can now treat the patient, do studies to answer the question, but if the answer is appropriate, then we can stop the treatment at certain point when patients are MRD negative. And so it will decrease utilization of therapy, it will decrease utilization of treatment, and provide depth of response that potentially can cure a patient. So my discussion and talk today is going to be on the methods we utilize, how they are useful in predicting outcome, and then how can we now incorporate in the future at different stages of the treatment to make myeloma not only controllable but curable in significant number of patients.